There we go. And I just want to say good morning or good afternoon, wherever you all are, and welcome to our seminar today on quality systems for hemp and CBD. And this is presented by one of our esteemed independent consultants, Charlotte Peyton. As you all know, I think everybody is a familiar company, at least. EAS is a member of the certified family of companies, and we are a global leader in regulatory solutions for industries regulated by FDA, USDA, and other federal and state agencies. Charlotte is one of over 150 independent consultants that are worldwide and provide all kinds of expertise, from good manufacturing practices, supplier qualifications, labeling, all kinds of things. So lots of capabilities should you have need after this session is over. Just a little bit about Charlotte. She's well known in the industry. She's an analytical chemist. She has exceptional analytical abilities, and she has 33 years of laboratory and regulatory experience. And she assists EAS clients with GMP audits, SOP development. She works closely with companies to ensure their practices are in line with both federal and state requirements, helps to strengthen any gaps. And she is a fantastic trainer, and we have a lot of ground to cover. So I know she is anxious to get started. Just as I mentioned before earlier, I will keep everybody's mics muted. I'm sorry, not muted, turned off. If you have a question, if you click the participant button, you should see the opportunity to raise your hand. And if you'll do so, then when Charlotte's ready for a break, we'll go ahead and call your name and then ask you to unmute at that time. So with that, I think I am ready to mute my own mic and turn it over to Charlotte.
All right, good morning, good afternoon. My name is Charlotte Peyton, and I am an independent consultant. And we are here to talk about hemp and CBD quality systems. So everything Amy said was true. I'm an analytical chemist. I have 33 years of different types of regulatory background. And among all those things, I actually was a previous owner in a marijuana startup company here in Colorado, right at the beginning of recreational. So I have a lot of hands-on experience with how those systems are, and sort of got to dive headfirst into all that new regulatory for them. So we will be talking about cannabis sativa, the actual scientific name of the plant. There are over 100 different cannabinoids contained in the plant. And the two of greatest interest, especially from a regulatory standpoint, are THC and CBD. THC, as you all know, has some analgesic properties. People use it for that. They also use it for an intoxicating effect. CBD does not have the intoxicating effect, and it is also used for anti-inflammatory, neuroprotective, and then anti-convulsant properties. So the plant is cannabis sativa. There is no difference in these marijuana or hemp, but due to the Farm Bill and the US Congress, they have decided that, legally speaking, not scientifically speaking, that marijuana is cannabis that is higher than 0.3% THC, and that hemp is any that has THC that's less than 0.3%. So because of this distinction and the differences between how the industry terminology is and the government terminology, I want to be sure to let you understand, when I hear the word cannabis, I assume it could be either one. As far as the US government is concerned, when they say cannabis, they generally mean hemp and CBD. But I do want to bring that up because having been in the marijuana industry, they very much dislike the term marijuana, and they think it's a derogatory term that was like back from the 1930s. So I will say marijuana and hemp just so that there is no confusion on that. So as of, excuse me, January 1st of this year, There were 47 different states and the District of Columbia that had some type of laws that legalized cannabis in some form. There is recreational use, also called adult use, for marijuana, medical use, and then there's other uses that mainly concern hemp and CBD. Here is a picture of the US with all the different states. The dark green is the adult use or recreational, where the states where that is legal. The light green is medical use only. And then the gray is limited use, they mean CBD and hemp. And then those 3 black states are the only ones that will not allow any type of cannabis use in their state. So that makes about 15 states plus Washington, D.C. that allows recreational use. There are 37 states that now allow medical use. More just keeps coming on all the time. 11 states that will allow hemp only. 3 states that allow no cannabis in any form. We'll take a look again. So that's Idaho, Nebraska, and Kansas. Kind of out there by themselves. So it's a huge industry. 2020 saw annual sales from all marijuana that were up 40% over 2019, but 2020 was a weird year. That's about $11 billion for recreational use, about $7 billion for medical use. As far as hemp and CBD sales go, there is the pharmaceutical registered with the FDA aspect of it. The first drug that managed to accomplish that was from GW Pharma, Epidiolex, and 2019 saw, almost $500 million in sales for that one product alone. 2019 saw about 1.2 billion in sales for CBD, and then last year it is estimated to be about 2.1 billion. As far as regulations go, on the marijuana side in the United States, it is state by state. They get to decide what regulations that they want to apply. There's very different perspectives in that. Colorado, when they first became legal for recreational use, they formed the MED, Marijuana Enforcement Division. That division was made up entirely of police officers. And we're talking at least captains and above, and that constituted the entire department. So they had no background in manufacturing. They had no background in, packaging, labeling, testing, any other aspect of the industry that we would do. So, but they have changed a lot. Even this year from January 1st, Colorado is now requiring a standardized sampling program, corrective action, preventative action. If you guys are in FDA regulated space at all, you understand that CAPA is a very common tool to use. And then they also have a standardized recall plan. So those are definitely items that you would find in pharmaceutical or dietary supplement regulatory requirements. So that part has been changing. So Colorado went that route. They were the first state from US marijuana. And then California it's also a very large market, had a very different approach. They tapped into the expertise that they already had on hand. For instance, for anything to do with cultivation, they had the Department of Agriculture for the state of California to administer that because they already had the expertise in there. And I thought that was a very useful approach. As far as hemp is concerned, if you're a drug, if you register as a drug, then Part 211 applies. And as we were saying before, that would be like GW Pharma and Epidiolex. I think there's a couple more now than there were previously. So then you would follow those 211 rules. For non-drug status, which is everything else, the FDA is currently using enforcement discretion for as long as the brand owners are not making any medical claims on labels or in any advertisement. That has been the only time that the FDA that I'm aware of has intervened in somebody's CBD business. So they're just doing enforcement discretion for now. The FDA has given us a few hints here and there. And one thing that they have come out and said is that they did not approve of CBD use in food. They have hinted that they might allow it as a dietary supplement, but we are not getting any clear information on that yet. One of the issues with CBD is that it does have some impact upon the human body. For instance, when you take CBD, that can monopolize enzymes in the liver, cytochrome P450, that's responsible for metabolizing. And so when you take some pharmaceutical medications, it can compete for that enzyme. And then the most dangerous example of that would be somebody who's on warfarin. And so warfarin can't metabolize, it can't clear your body. And so if you're taking a high amount of CBD, it would be possible for you to poison yourself with the warfarin. And that has, some very lethal side effects to it. And that is pretty much one of the reasons that the FDA, one of the concerns that they have about CBD and putting it in food. So some of the regulatory hurdles that we have to overcome in the US is being able to fit hemp and hemp products into the existing structure of the FDA. I don't think anybody is anticipating that the FDA is going to have its own set of regulations for hemp outside of what's already here. So let's take a look at some of these categories and see if we can sort of make sense and sort this out. So as far as raw material categories that might be used for production, there is hemp flower. Hemp flower, you can find it for sale, but it's really not very commonly sold as a retail product to smoke. You do have hemp extracts. Hemp extracts kind of come in about 3 different types. And there's some different terminology usage for these types, but this is basically the groups. You have a full spectrum, which is extracted with most or all of the plant components included. So it normally has the lowest amount of CBD concentration, but that is something that more closely resembles the plant product of flower. Some people take that full spectrum after removing the lipids and then make a distillate out of it. A distillate is done by distillation. It's got more concentration of CBD in there, but when you do that distillation, you tend to lose some of the lower boiling point terpenes and the other cannabinoids in there. The third different kind of extract that is very popular lately is a low or 0% THC extract. What they do is they have a couple of different methods that people use that they target removing just the THC that's in the oil. So then that's closer to being distillate or full spectrum. As an analytical chemist, I can tell you there is no such thing as 0. So what they really mean to say is like in rounding, probably like 0.0, something of that nature. The other major category for hemp products would be CBD isolate. Now, CBD isolate takes that distillation and takes it to the nth level. It is recrystallized. It is almost pure. You can get isolate that's almost 100%. And that means it is like a white crystalline powder. So here is a slide that contains all of the major groups of product types that will be regulated by the FDA. There's food, there's dietary supplements. Under pharmaceutical drugs, you have prescription, you have over-the-counter, vaccines, biopharmaceuticals, medical devices, cosmetics. blood for transfusion, animal foods and feed, different types of veterinary medicines, and then tobacco, which we don't actually have regulations yet for, but they keep saying very soon. So now let's try to match up some of these product types into where they might possibly fit in these FDA categories. A flower product would exactly be a botanical, and botanicals are generally dietary supplements. As far as the extract category goes, a full spectrum would definitely be classified as a botanical extract. It's fairly close to what contains in the plant, which to me would be regulated as a diet, most likely to be a dietary supplement. The distillate is similar to the full spectrum. The CBD content is increased over what the full spectrum would be. So, you know, depending on what the FDA sees, it might be a dietary supplement. It might be more like a pharmaceutical. And then that low or 0% THC extract seems like it would be more similar to a full spectrum, but just have no THC in there. So I'm guessing it would most likely be a dietary supplement. And now we come to the CBD isolate. That CBD isolate is more, since it's purified to the point where it's a crystalline pure substance, that is much more in common with a pharmaceutical raw material than it is with anything to do with dietary supplement. You could literally synthesize CBD isolate. So that would be hard to justify going into that dietary supplement category. So when we look at these finished products, from the perspective of the delivery route into the body, this also is kind of interesting. So topicals that you see in sale, for sale in stores are generally, you know, CBD creams, salves, oils, and the way those are produced and marketed would be more like a cosmetic than anything else. And I think that is why a lot of these drugstores and grocery stores are willing to take that legal chance and have those for sale in retail stores, is because they are kind of in that cosmetic category. If you look at an oral delivery route, then gummies, capsules, soft gels, tinctures, anything that's taken orally, that would be more pharma or possibly dietary supplement. I didn't include foods and drinks in here, mainly because the FDA seems to have the most issue with that food category. And I think that is due to a lack of dosage. When I try to explain that to people, it's like coffee. I have usually 1 cup of coffee in the morning, and that's it for me for the day. My husband will go through 12 cups of coffee in a day, easy. So if we both were putting CBD in our coffee, then he would get a much bigger daily dose than I would just through what he normally does. There is the inhalation route, vape oil, the inhalation devices, like for albuterol. I've seen people selling that with CBD in there, and that's definitely a pharmaceutical type application. Nasal sprays in the nose, definitely OTC and sort of a pharma that fits that category better. And then the most interesting one to me that is really could go either way is a sublingual. It's very common in the hemp industry and also in the marijuana industry to sell tinctures and then put on the label the description of to put it under your tongue and hold it there for a few minutes. So that sublingual application is definitely not dietary supplement. And the FDA has issued warning letters in the past that's saying that, you know, dietary supplement category is for products that are only ingested, nothing that, you know, that sublingual hits that venous under your tongue and does that quick absorption. It is very effective, but there might be some regulatory issues with that. So we're always on the lookout for the latest developments for the hemp regulatory. issues in the US. We did hear rumors last summer that there was a guidance document drawn up for the FDA and or by the FDA, and they had sent it to the White House. And apparently, things were too distracting last year. That never left the desk and never got issued. So what I've read lately is that that guidance document has been withdrawn and it will be represented to the new administration. So we can hurry up and sit and wait for that. I did hear, and there people are always putting in, submitting new legislation for consideration in the Capitol. Hemp and hemp-derived CBD Consumer Protection and Market Stabilization Act of 2021. Apparently that was introduced on February the 4th of this year. And it looks like this is the second time that it has tried to get out of the House of Representatives. And this particular bill allows products as dietary supplements if the products comply with the FDA new dietary ingredient requirements. We'll see if they can get that through and then what the FDA will do with that. The other regulatory development that I heard just yesterday on the news was that the EU has announced that they will accept CBD in food after the companies that want to do that have submitted data. So that's interesting and exactly a polar opposite of what the FDA has indicated up to now. So we will just have to wait and see. So there are different reasons why you would need a quality system for your cannabis company. If you are preparing for FDA compliance for hemp, it is in your best interest, if you don't have a system, to start building that. It does take a while, and if the FDA announced tomorrow that you needed to comply with a dietary supplement or whatever, food or whatever they decide to be able to sell your products, then it would take some time to build that system if you don't already have it. So it's a good idea to kind of start getting that in place. They will regulate the hemp industry in some way going forward. We're just not really sure how. Lots of states have regulations for hemp, and if you have marijuana, they have to have regulations. Just as a general business practice to control your product manufacturing, good batch records and qualifying your vendors, that whole approach can save you money by controlling your product usage. SOPs and training help ensure consistent product and then fewer mistakes. Nothing's worse than having a nice expensive batch altogether and then you have to reject it and waste the product. It gets to be a very expensive thing. As far as your customer and your sales go, for you to be able to have a consistent product quality always helps with sales. They know exactly what to expect. You're best able to achieve that through having a batch record and making your product consistently. You also would need to protect your consumer safety. And I don't know the age of my audience, but if you can remember the Tylenol fiasco years ago, that took forever for people to get reassured that Tylenol was safe enough to take again. Marketing to customers that are going to expect control and GMP compliance. There is few companies that will go all the way, they say from seed to sale, controlling every single step of the way. And we will look at that a little bit further in the presentation. But any link, like if you are buying a service from the person up the river a little bit, you're going to want to make sure they're GMP compliant. When you sell your stuff to the next person, if you're doing manufacturing and you're selling it to somebody who's going to sell at retail, they want to make sure you're GMP compliant. That is the biggest motivator I see right now in the industry for consulting services, is people saying it's like, I have to be GMP compliant. I have to be certified. So good manufacturing practices is what this is all about. The regulations that are issued and enforced by the Food Drug Administration, FDA, to control and supervise companies that manufacture, package, hold, and distribute foods, dietary supplements, drugs, and cosmetics to the public. GMPs are a system of procedures and documentation for proper design, monitoring, and control of manufacturing processes and facilities to ensure product has the identity, strength, quality, and purity which it is represented to possess. This slide, we've already gone over this before, but these are all the different sections. These are all the different numbers and titles to be able to look this up. All of these regulatory regulations are on the FDA website and are available to the public. Here's the two main terms that you want to be familiar with as far as dealing with the FDA. Every warning letter 483 that they put out, they will call out adulteration or misbranding. So adulterated product within the meaning of section 402G1 of the FD&C Act, when products have been prepared, packaged, or held under conditions that do not meet GMP requirements. Products are misbranded within the meaning of section 403 when the product fails to meet label claims and labeling requirements, and that has to do with testing a lot. So current GMPs, the C and CGMP means current and requires the use of modern technologies, up-to-date systems, and innovative approaches to comply with the regulations, but also achieve higher quality through continual improvement. So GMPs are not a static thing. You can't just get there and say, okay, I'm done. Things are constantly changing. The FDA will have constant requirements. They'll change rules and give additional guidances when something new has happened. You're never caught up. Adhering to CGMP regulations requires a quality system approach to manufacturing, enabling companies to minimize or eliminate instances of contamination, mix-ups, and errors. This in turn protects the consumer from purchasing a product that is not effective or might be even dangerous. So a quality management system is a formalized system that documents processes, procedures, and responsibilities for achieving quality policies and objectives. A QMS system coordinate and direct an organization's activities to meet customer and regulatory requirements and improve its effectiveness and efficiency on a continuous basis. So a quality system is going to set company policies. It's going to define and improve those processes. It's going to facilitate training. It's going to reduce waste. It's going to lower your cost, and it's going to engage your personnel. So quality and management, you can have the best quality staff ever assembled, and if the management does not support them and give them the ability to do what they need to do, it won't matter. So management support is crucial and critical. The corporate leadership is essential in establishing and maintaining a company-wide commitment to quality and the adherence to the quality systems. Management must give quality not only the responsibility to do this, but also the authority to enforce the quality system. They must promote robust quality systems. They must enforce commitment to quality through the entire company. Quality decisions must supersede business needs, and this one's really, really hard, especially if you get into an industry where, you know, they haven't had to deal with regulations at all. So they just assume the business needs are first, but no. You have to ensure that only acceptable product is released, and that's some of those business decisions. Once it is determined that defective product warrants a market withdrawal or a recall, there should be no hesitation in removing the defective product from the market. And that's in your company's best interest also. So here's a list of typical subparts of a quality management system. Besides the general provisions, there would be a section on personnel. You'd have to look at the physical plant and grounds, the equipment you use and utensils, the specifications and testing, all the responsibilities of the quality unit, components, packaging and labels, master manufacturing record, batch production record, laboratory operations, manufacturing operations, packaging and labeling operations, holding and distribution, how to deal with returned products, how to deal with product complaints, and then records and record keeping. I do want to say that because we are constrained by 4 hours over 2 days, most of these topics I'm going to skim through, with the exception of specifications and testing, the master manufacturing records, the batch production records, and the quality unit responsibilities. Of all the warning letters that go out that we can track and see, those are the 3 that make up between 1/2 and 3/4 of all the warning letters every year. So since those get the most hits from the FDA, I thought we would just go a little bit deeper into those 3 sets of topics. I do want to take a minute to discuss contract manufacturers, contract labs. There are very few companies that do everything from start to finish: cultivation, extraction, manufacturing, testing, packaging, distribution. A lot of people, some people even have virtual companies where they contract out everything. Especially want to make people who are not used to being regulated, make them aware that the FDA says that if you sub out any of your responsibilities, you're still responsible for that. So if you hire somebody to do your manufacturing, it does not matter. If you pick somebody who's not complying with the regulations, the FDA will hold the brand owner responsible. And that goes for packaging, for testing, distribution, any other contract activity that you employ them. So if you do employ contract manufacturers, labs, packagers, you need to make sure that they are an FDA registered facility. You need to make sure that that company is qualified through an audit process for all the regulations that are applicable to them. You don't have to be the person to do the audit. You can hire somebody if you feel like you don't understand that process well enough, but you need to do that. There are numerous 483 and warning letters that establish that this is true, and the FDA goes through periods of time where they'll tend to focus the entire FDA on one aspect or another and kind of go through a lot of companies with that. And we're seeing that more and more with the contract laboratories and manufacturers. When you look through the warning letters on the FDA website, you can look for them being listed as own label distributors. And those would be the types of virtual companies that contract out a lot. So we're going to start with quality unit responsibilities. It's huge. They are responsible to create, monitor, and implement the quality system, to assess the suitability of incoming components, containers, closures, labeling, in-process materials, and the finished product. They're in charge of evaluating the performance of the manufacturing process to ensure adherence to proper controls, procedures, and specifications. They're responsible for the acceptability of each batch for release. Nobody else can release that. Quality has to be the one to do that. Review and approve all the procedures related to GMP activities and all the associated records that go with that. all of the investigations, non-conforming products, corrective and preventative actions, out of specifications, deviations, complaints, and returns. And then they're also in charge of auditing, performing, or evaluating and doing trend analysis. So here's some of the dietary supplement regulations that give you like examples of where to go look in the regs that cover that they're responsible for all these things. So in addition to the other day-to-day responsibilities that they have, they're also normally in charge of regulatory affairs, managing FDA and other governing bodies, inspections, correspondent, registration, and related requirements. If the FDA shows up to do an inspection, you don't want the CEO being the person to walk the FDA around. You'll get in a lot of trouble really quick. So let them say hi and shake hands and then put quality in charge of that. They need to stay current on regulatory and compendial updates and changes. And this one, I highlighted this because this is really true for the cannabis industry. They should be in charge of monitoring the company publications and social media for compliance. This is the place where companies get in trouble the easiest with the FDA. Sometimes for state-driven marijuana, it's the same thing. They have the same requirements. On social media, on publications, everybody wants to make what will be interpreted as medical claims. This is good for arthritis. This is good for epilepsy, whatever people want to say. Even if your customers claim that and post it on your website, you're still responsible for it. So really important that quality is involved in that. Other responsibilities that the quality unit would have would be vendor and contractor audits, quality agreements, which is another thing the FDA has really been pushing on, your change control system, your facility validation program, any stability program that you're running, and then training personnel. So in summary, in order to accomplish all of these tasks and meet all the responsibilities set forth in 111, the quality unit must have the appropriate authority and resources. They need to be independent of production management. I've seen this over and over again where the upper management of the company want to put quality reporting to production management. It's a really bad idea. It's always a conflict of interest. You have production who is supposed to go really fast and make a bunch of money, and you have quality that's charged with being in control of the regulations. And basically, they want to make it perfect, and then production wants to go fast. And so they're always going to be sort of a head bump between the two organizations. And if you have one reporting to the other, it's just going to set up lots of problems. You need to have that difference documented on the company org chart. That's one of the first things the FDA will ask for walking in, be to take a look at that org chart, and that's why. They want to make sure that quality reports to the top of the company. They also are responsible for making sure that the company is sufficiently staffed with qualified personnel. In the end, the quality systems, quality products, and the CMG compliance are everybody's responsibility. You can't just depend on the quality unit to fix it. It has to become a culture in the company that this is what we do and this is how we do it. The other very important thing that goes on with quality is records and record keeping. You must have procedures and supporting documentation for all GMP related activities. There's a saying that people have, if it was not documented, then it was not done. And a lot of people will say GMP stands for give more paper, get more people. And that's generally what happens when you institute a GMP program in your company. Records, written records have to be kept for the designated period. Records must be kept as original records, as true copies, such as photocopies, microfilm, microfiche. I don't know that anybody even does that anymore, or other accurate reproductions of the original records, or as electronic records. If you go the electronic record route, then you need to comply with 21 CFR Part 11, electronic records and electronic signatures. It is very advisable to either have a paper system or a fully electronic system. The two don't mix very well. Regulatory agency must be allowed to access these records. All required records or copies readily available during the retention time period for inspection and copying if requested. I've seen the FDA expect to have them almost immediately during an audit. So you want to have those sorted, organized, and ready to go if the FDA walks in. So we have good documentation practices. Records must be generated and maintained so that the data therein can be used for evaluation as well as for investigational purposes and other periodic reviews. So the tenets of good documentation practices is that you must document the activity at the time of performance. This is one where a lot of people easily get into trouble. You don't write down what you did the day before. You don't write down what you did later that day or the day after. You need to do it right at the time. Again, if you're in an audit situation and somebody comes through and you're busy producing a lot of work and you haven't written anything down on your form or in your book, then they know what you do, and so you'll be in trouble. All the documentation must be in a permanent fashion, and it must be legible. No whiteout, no pencils. There can't be anything that you write that can be altered. And legibility, oh my gosh. So I've run a lab for lots of years, and if you can't read it, it doesn't even matter if it was written down or not. So people have to slow down and write in such a way that you can read it later. It should also indicate who performs the activity and when it was performed with a signature or initials and date. Very important. So all numerical entries must include units, such as kilograms, and recorded exactly as it's seen on the equipment. So if you weigh something on a balance, you need to write down exactly what it said. Don't round it, don't do anything to it, record it exactly as you've seen it. Because if you were, electronic records, you would have that printout from the balance and it would be exactly the same. Errors must be crossed out with a single line and corrected with a reason given for the change. You may not write over and make crossouts. So if you look at these examples on the slide, the upper left-hand corner one, you can tell where there's something under it, but they kind of wrote over it, and you can't really be sure of what that says. So down below there, you can see where they wrote 113.97 and then scribbled on it. So you're obscuring the original entry at that point. So then they rewrote the real one underneath it, 119.37. So what you actually should do is the example on the right-hand side. If you wrote the wrong thing, you do a single line crossout, and then you write what you truly meant to write, and then you give a reason why when you record it, along with your initials and your date. Personnel is another section of quality systems. You want to be sure and hire good people and then develop them to be even better. People are always your most important resource. They're also the major contributor for errors and product defects and GMP non-compliance. So training is very important. It's essential to properly perform and control your operations. So it is a GMP requirement that you have qualified employees. Each person engaged in GMP operations must have the education, training, and experience to perform their assigned job function. You have to identify who is responsible for quality operations. Those quality responsibilities must be distinct and separate from other responsibilities. You can't be the quality policeman and also the person doing the work. So you must have qualified employees to supervise CGMP operations. And for dietary supplements, you have to have a sanitation supervisor to be assigned to oversee facility cleanliness and sanitation. So you're going to put together a file that are your training records. Some of the things you need to have in there, one is a job description, the job description of the required education, training, and experience, responsibilities for each assigned job function or title. So for every position in your company, you should have a job description and what it requires to perform that job. A training record is used to document that each individual possesses the requirements indicated in the job description. This will include both on-the-job training as well as prior education and experience. So you need to have a list of what type of training it is, what the date of your training was, who was the person trained, and who was the trainer. Sometimes people will do that individually per person. Sometimes you'll do it as a group and have a one document with all that in there. So training records, you need to have education and experience. You can do that through a resume, through a CV, a job application. Some people use a biography. You need to have records of your on-the-job training, both process and procedural. So there's a big difference between read and understood and proficiency testing. For instance, if I was learning to do HPLC, somebody might give me the SOP for HPLC and I would sit and read it, and there might be so much that you understand, but because it's a complicated process, I would also be do proficiency testing. So somebody would have me perform the operation, and then I would be tested on whether I could do that. On-the-job training also is for course attendance, and then, you know, any kind of certifications that you received from having courses. The training must include the initial and the follow-up GMP training. So annually, you will always do GMP training. And if it's just like it was last year, that's fine. You still have to do it every year. Also, with personnel, you need to teach them about microbial contamination. You must take measures to exclude from CGMB operations persons who might be a source of microbial contamination from illness, from infection, open lesions, skin contact, or any other abnormal source. You need to instruct your employees to notify the supervisor if there is reasonable possibility that they have a contagious health condition. Personal hygiene is also very important. Train them with that. You must use hygienic practices to protect against contamination of the material or the product. All employees must wash their hands thoroughly using single-use soap and hot water before starting work, after breaks, and after using the restroom. In areas where components, products, and contact surfaces are exposed, do not store clothing and personal belongings. Do not eat food. Do not chew gum. Do not drink beverages or use tobacco products. Personal cleanliness must be maintained in areas where components, products, and contact surfaces are exposed to prevent contamination from microorganisms, filth, extraneous materials such as perspiration, hair, cosmetics, tobacco, chemicals, or medicines applied to the skin. In areas where components, products, and contact surfaces are exposed, employees must wear appropriate outer garments such as lab coats, eye protection, gloves, hairnets, beard covers, shoe covers, and also remove unsecured jewelry or other objects. I have heard that if somebody wants to wear their wedding ring and doesn't want to take it off, you could put tape over it, but you have to secure it. Now we will take a look at the physical plant and the grounds. The physical plant is all or any part of a building or facility used for or in connection with manufacturing, packaging, labeling, or holding the product. And we're going to look at both the interior and the exterior. Both the internal and external areas must be appropriate in structure and design and maintained in a clean and sanitary manner to prevent product contamination. So the first thing that the FDA will do when they come to see you unannounced, before they ever walk into the front door, if they are able to, they will walk around your building and look and see what you have outside. You want the plant grounds to be maintained to protect against contamination. You want to make sure that your equipment is properly stored and not just stacked up outside the door, that weeds and grass are cut with in immediate vicinity of the physical plant, that litter and waste is removed, that roads, yards, parking lots maintained. There is adequate drainage. You don't want to have any standing water, and that you have adequate systems for waste treatment and disposal. So as you can see in the picture here, there's a staircase leading into the facility, but there's like waist-high weeds all the way across. That gives a nice area for rats, mice, all kinds of animals, insects to hide and live, and then when the doors open, be able to make a run for it. So your physical plant must be suitable in size, construction, and design to facilitate maintenance, cleaning, and sanitizing. All areas of the warehouse, including the wall perimeters and corners, must be kept clean, orderly, and free of debris. Blowers, vents, and grids must be kept free of grease and dirt buildup. Plant must provide appropriate temperature, humidity, and light conditions for the storage and use of the materials and products. To prevent components, products, or contact surfaces from becoming contaminated, the physical plant must be clean, must be sanitary, and must be adequately repaired. So you can't have holes, cracks in the walls, floors, ceilings, doors, windows. You need to treat the plant using a process to destroy or substantially reduce levels of microorganisms of public health significance without adversely affecting the product or its safety for the consumer. So you have to have a way to clean your facility and not contaminate your product. So cleaning is not just for floors. You're going to clean tables, trash cans, clean under the tables, restrooms, clean up the area, your work area when you're done with your, I'm sorry, your lunch or your break. Mops, brooms, and squeegees must have hanging storage fixtures and not be sitting on the floor. And then we have a cleaning chart over here on the right-hand side of the slide. Like everything else, if you don't document it, it didn't happen as far as the FDA is concerned. So you need to make sure that you have all of these cleaning activities done on a schedule, documented in an SOP with forms that can be completed and stored and then pulled up by somebody in an audit situation. You must have adequate space for orderly placement of equipment and holding materials to prevent contamination and mix-up of materials. Must have separate or defined areas provided for different types of materials. An example of that would be foods, dietary supplements, drugs, and cosmetics. Separate or defined areas are provided for materials and products of different status. Materials and products must be identified by this status at all times. When a material comes in before it's been accepted by quality, it needs to be labeled as quarantined. And then after it has been inspected by quality, it would either be rejected or accepted. A lot of people like to use color coding for stickers or signs to let people visually be able to see from a distance what the status of the material is. So pest control. Oh, this picture is horrible. This picture is of a gentleman working in a factory, and he had tape around the bottom of his ankles, or the bottom of his pants there. And when asked why he had his pants taped up, he said, "That's so the rats can't bite my ankles." So they definitely had a pest control problem. So a pest is any objectionable insect or other animal, including birds, rodents, flies, mites, or larvae. Rodents are known to spread as many as 35 different diseases to humans worldwide. And so it spreads through direct contact with rodents or their feces, urine, or saliva, or through rodent bites. And that would also include ticks, mites, fleas that have been feeding on the sick rodents, also can spread disease. So you have to take effective measures to exclude pests from plants and protect them against contamination. So animals and pests are not allowed in the plant. The only animals you can have are guards or guide dogs that can be allowed in some areas, as long as it doesn't contaminate the materials and contact surfaces. You need to make sure to keep doors to your facility closed at all times unless somebody's actively using it. You need to use pest control traps, both inside and outside, and lights, and little bug lights. Pesticides used per the instructions and government regulations. You only want to use what's approved for use in food processing facilities. And it is always a good idea to hire a professional pest control company, because there's lots of documentation that goes along with that. For the facility, if you use allergens, you're expected to operate in a certain way. Allergic reactions are conditions which the immune system reacts abnormally to a foreign substance known as an allergen. You have to institute controls to prevent cross-contamination of allergens with other products. So the FDA has defined 8 known food allergens: milk, eggs, fish, crustacean shellfish, tree nuts, peanuts, wheat, and soybeans. An allergen program must be developed and implemented to prevent cross-contamination of allergens. So you're going to have separated, defined areas for different types of allergens. Another thing that is useful is to store allergens on the bottom of a rack so that they won't be on top. If they spill on the material below. Allergens identified as allergen types at all times. So I have to be well labeled. Equipment and utensils. You must use equipment and utensils that are of appropriate design, construction, and workmanship to enable them to be suitable for their intended use and to be adequately cleaned and properly maintained. I think it's pretty safe to say everybody in the cannabis industry uses a lot of stainless steel. They have to, because things get really sticky and messy and hard to clean. with that oil. So equipment and utensils must be installed and maintained to facilitate cleaning of the equipment, utensils, and all adjacent spaces. Your equipment must be corrosion resistant, should be made of non-toxic metals, and able to withstand the environment in which it's used. In particular, you need to make sure that it can handle the temperature and humidity, and also that it can handle the cleaning compounds and sanitizers that you use to clean it. Calibration of your equipment is extremely important. Instruments and controls used in manufacturing or testing must be calibrated. So equipment calibration, before you first use it or use it the first time, you have to perform what's called an installation qualification at a frequency specified in writing by the manufacturer of the instrument control, which would be the operational qualification, and at routine intervals or as necessary to ensure the accuracy and precision of the instrument or control, which would be a performance qualification. Repair or replace instruments or controls that cannot be adjusted to agree with the reference standard. So everything that measures has to have a qualification, and that would be used by having a protocol outlined ahead of time that's approved by quality, executing the protocol, and then afterwards writing a summary report. The stickers on the bottom would be like a calibration sticker. The green one would be that it passed, and it would have on there what the equipment was, the serial number, when it was qualified, when it was due next qualification. And that red and white one is to draw your attention to the fact that it is out of calibration and do not use. It's always better to remove the equipment that won't calibrate correctly, but if you can't, then make sure it's labeled. You must do maintenance of the equipment. The equipment must be maintained to protect the components and products from being contaminated by any source. The equipment and utensils take apart as necessary for thorough maintenance, cleaning, and sanitizing. Anything that's a single service article must be appropriately stored, dispensed, and disposed of. So like if you have disposable samplers for your raw materials, then you would want to make sure that those are well stored and organized and clean. And then when you use it the one time, that it gets appropriately thrown away. Store cleaned and sanitized portable equipment and utensils in a manner that protects them from contamination. This sounds really obvious, but I've seen tons and tons of times where somebody would clean equipment, clean bowls, whatever, and then store them in a place where they just sit there and get dirty right away. That doesn't help you. Master manufacturing records, also known as MMRs. An MMR should be prepared and followed for each formulation the company manufactures and for each batch size to ensure uniformity of the finished batch from batch to batch. So as an example to that, say you're making a tincture, it's lemon flavored, you're going to put it in a 50 fluid ounce bottle, and you're going to do a 50,000 bottle run. So you would have an MMR for that. If you decided you also wanted to do a 100,000 bottle run, you would have to write a second MMR, a second recipe for how you would do that. And then the third example is if you wanted to do another one that was tincture, lemon flavor, but a bottle half that size at 25 fluid ounces, and you wanted to do a 50,000 bottle run, then again, you would need a separate one for that. You can't make one that's good for different uses and share them. And then the last example is like you want to do the same thing, but you want it to be cherry flavor. So you are required to make yet another complete master manufacturing record. The purpose of an MMR is to provide detailed instructions for each point, step, or stage of the manufacturing and packaging process to consistently make a product and achieve quality standards for identity, purity, strength, composition, and a lack of contaminants. You need to identify specifications for those steps, points, or stages in the manufacturing process where control is necessary to ensure the quality of the finished product. And you need to establish controls and procedures to ensure that each batch is manufactured meets the specifications identified for the product. So the contents of the MMR, you're going to have the name of the product on there, the strength of it, a concentration, the weight or measure of each ingredient for each batch size. You're going to have a complete list of all the components to be used. You're going to have an accurate statement of the weight or the measure of each component to be used, a statement of any intentional ingredient overage amount. That is for dietary supplements that degrade. Probably won't be seeing that with CBD. A statement of theoretical yield expected at each step of the process where control is needed to ensure quality and the expected yield when the manufacturing is finished, including the maximum and minimum percentages of theoretical yield beyond which a deviation investigation and quality investigation is conducted and decision is made. That's a long paragraph. What it means is that you expect a yield at every step. If that yield is really off and you're outside that max and min percentage that you've allowed yourself, then quality is going to do a deviation investigation and find out what went wrong. Did somebody forget to put something in? Did they put twice as much as they should have? And do that investigation. A description of packaging and a representative label or a cross-reference to a physical location of the actual or representative label. So all those things need to be in there. You're going to have MMR written instructions. There will be specifications for each point, step, or stage in the process where control is necessary to ensure the quality of the product and that the product is packaged and labeled as specified in the master manufacturing record. You're going to have procedures for sampling and cross-reference to procedures for testing or examinations. You're going to have specific actions necessary to perform and verify points, steps, or stages in the manufacturing process where control is necessary to ensure the quality of the product and that the product is packaged and labeled as specified in the MMR. Two particular points they request is that you have one person weighing or measuring a component, and then another person is verifying the weight or the measure. Also, that one person adding the component and another person is verifying the addition. It's just a double check to make sure that what was written down actually occurred. So there are some practical considerations for MMRs. It is helpful when you make your MMR to divide or separate it into a manufacturing section and a packaging labeling section. That way, production can work on the first part of it, and then packaging is always in a separate area, so then you can take the materials and the MMR and move that to packaging or labeling. You want to be able to assign the MMR a document number and make revisions through the change control process. You want to include a revision history section on the MMR to easily review changes to the MMR over time. The MMR is probably the most important document you have. And so when you make a change to it, you've been selling product and you have a system that works and you make a change to it, it's extremely important that you document not only when you changed it, but what you changed about it. And then track those changes. It's good for investigation purposes. If you have an issue, a product complaint or something later on, then you can go back to the revision that you used and see if something was the fault in that MMR. The quality unit must review and approve the MMR to finalize it. And when using contract manufacturers, both the customer owner and the manufacturer should review and approve the MMR. So again, when you're using that contract manufacturer, you want to be sure that both parties acknowledge and approve any change. If you're the brand owner, you darn sure don't want your manufacturer making changes to the formula or the way it's put together or anything like that without your consent and knowledge. And also, you can't make changes to what the manufacturer is going to do without working with them and making sure they understand what needs to be done. So you have to work closely together. So now we'll move to the batch production record. What I do want to say at this point is that if you're unfamiliar with these two, the MMR, look at that as an oversimplification, but look at the MMR as a blank record, a recipe, if you will, of how to make your product, with places in there to record every time somebody does a step. And the BPR is actually just a copy of that MMR that has been completed and it's being used for a particular batch. So the batch production record, the company should prepare a batch production record for every time a batch or a lot of product is manufactured and packaged. The BPR should accurately follow the corresponding MMR and include complete information relating to the production and control of each batch. Again, the documentation must be done at the time of performance of the manufacture of the batch, including the date on which each step of the MMR was performed and the initials of the person performing each step. Again, when it comes back, if you have anything that goes wrong or a complaint later, you go back to that batch production record. You can see exactly who did each thing, when they did it, and make sure that there are no holes in that record. So the contents of a BPR would be the batch, lot, or control number that the company assigns to the finished product. The identity of the equipment and processing lines that are used in production of the batch, the date and time of any maintenance, cleaning, or sanitizing of the equipment and processing lines used in that batch, or a cross-reference to the records such as individual equipment logs where this information is retained. The unique identifier that you assigned to each component, packaging, and label used. The identity and weight or measure of each component that you use in the production. You also want as contents a statement of the actual yield and a statement of the percentage of the theoretical yield at appropriate phases of processing, including the allowable percent yield range. You want to have the actual results obtained during any monitoring operations, the results of any testing or examination performed during the production, or the cross-reference to such results, and documentation that the finished product meets established specifications. The quality unit must review and approve all completed batch production records. This is an essential part of the checks and balances aspect of GMP. So the manufacturing batch production record documentation, you want to have at the time of performance of the manufacture of the batch, including the date on which each step of the master manufacturing record was performed, the initials of the persons performing each step, including the initials of the person responsible for weighing or measuring each component used in the batch, the initials of the person responsible for verifying the weight or measure of each component used in the batch, the initials of the person responsible for adding the component to the batch, and the initials of the person responsible for verifying the addition of components to the batch at the time of performance. Same set of circumstances for the packaging portion of the BPR documentation. You want to have documentation at the time of performance of packaging, labeling operations, including the unique identifier that you assign to the packaging and labels used, the quantity of the packaging and labeling used, when the label reconciliation is required, reconciliation of any discrepancies between the issuance and the use of labels, an actual or representative label cross-reference to the physical location of the actual or representative label specified in the MMR. And then you want to have the results of any test or examinations conducted on packaged and labeled product or any cross-reference to the physical location of such results. So you want to have a quality unit review on that batch record. You want to have documentation at the time of performance that the quality control personnel reviewed the batch production record, including the review of any monitoring operation required under subpart E, requirement to establish a production and process control system, the review of any results of any tests and examinations, including tests and examinations conducted on the components, on in-process materials, on finished batches, or on packaged and labeled product. You want to have quality approve or reject any reprocessing or repackaging. You want to have quality approve and release or reject the batch for distribution, including any reprocessed batch. And you want to have the quality unit approve and release or reject the packaged and labeled product, including any repackaged or relabeled product. So as we said before, quality is always very, very busy. So you want to have documentation at the time of performance of any required material review and disposition decision that shows that quality was in charge of those decisions. You want to have documentation at the time of performance of any reprocessing of the product or materials. Some practical considerations for the batch records would be to perform a manufacturing department supervisory review of the BPR prior to the quality unit review. That's just very, very practical and useful. If you have the supervisor for manufacturing, go back through that BPR before you submit it to quality and make sure that every entry is completed, that there's no questions. If he can read it and understand it, if everything's documented, then that saves a lot of time for quality to go back and have to ask for that. And then you want to be sure and document that review on your batch record. It's very helpful to have a batch record checklist to ensure that thorough and consistent quality unit review. So you're just going to make a list of everything that you have to look for to release that batch. Include a quality unit disposition section on the checklist to indicate the release or the rejection of the batch. When using a control contract manufacturers, both the owner, customer, and the manufacturer quality units should review and approve the BPR. And you'll get a little pushback from that, but it's worth it. Here is an example of that quality release checklist that I was just describing. So that would just be, attached to the batch record. And you could go through and say, okay, here's the product item number, here's the batch number. Do I have the batch production record? Do I have the batch packaging record? Do I have analytical laboratory test, microbiological laboratory test? And then if you had send outs for a contract lab, do I have included in the documentation a batch certificate of analysis? Have I double checked, did I have the raw and packaging materials approved? Was the label approved? Was there a material review report? Was there any rework, reprocessing in the record? And then that quality status decision, that is so helpful. It's either released or it's on hold or it's rejected. And then whoever did that check to make sure all that documentation was there would sign it and date it. If you don't have a checklist like that, it's very possible that somebody could accidentally overlook things. Checklists always ensure that everybody's at the same level. Other practical considerations would be to utilize a quality incidents page to document the occurrence of any deviations, out of specification investigations, quality investigations, or material reviews that are associated with that batch record. For batch records that are rejected, it's good to develop a reprocessing form that references the material review and incorporates detailed instructions and a quality unit review and approval. And then you would include the form with the reprocessed batch record. All right, well, I got finished a little early. Amy, did you have any questions?
Yes, Steve, I see you raised your hand. If you would like to unmute your microphone and ask your question. I just sent, there we go. Okay. Steve, we should be able to hear you. Go ahead. Uh-oh. Steve, are you there? I'm guessing, Steve, the microphone, when you put the microphone, I'm sorry, the speakers on a one that was audible to the rest of the room, perhaps.
Oh,
there you are. Now I think we can hear you.
Can you hear me now?
We can hear you. Okay, good.
Okay. All right. Will the presentation be available for us, like a recording of it or a slide deck?
So a slide deck was sent out yesterday.
Okay.
Yep. This is considered a live training, so we are not providing a recording to participants after the fact.
Okay. Thank you.
You're welcome.
I have a second question.
Sure.
I was involved in the tobacco industry years ago when Congress passed the Tobacco Control Act. And I think there was mention earlier about that there was a possibility of regulation that was going through the House at the federal level. Wouldn't that have to take place first before FDA would have any authority to regulate CBD or hemp type products in the market?
Well, I think that's apples and oranges. I think that that whole Tobacco Act and those regulations, I was just mentioning them as part of the bigger picture. They don't really have anything to do with each other.
I realize that, but I'm saying that, I guess, excuse me, go ahead.
The Tobacco Act has been passed. They are taking applications for a lot of the tobacco companies, depending on if you're an ends product or a regular cigarette, pipes, all that. And so that's moving along. We're just waiting for actual regulations from the FDA, specific instructions like we have for pharma and for dietary supplement and food.
Okay, so are you saying then that the FDA has been given authority to regulate CBD at the federal level?
The Farm Bill of 2018 gave the FDA authority to regulate hemp.
Okay,
So that's been done. They've just been, the FDA doesn't move real fast. They just don't have a
No,
history of that.
yeah.
So we're waiting. Like I said, we were excited to hear rumors of getting that guidance document. Even that would have been a great help.
Uh-huh.
But yeah, we're just waiting. Maybe they'll move this year, but like I said, with COVID and everything else, I think there's a lot of people really busy.
Yeah, I don't know. Tobacco wasn't given much of a high priority for many years, so I didn't hold my breath on that one. I'm not,
Right.
I mean, I hope it comes through for CBD and hemp type products, but I'll be surprised if it does.
Well,
What they do, they kind of leave it up to the manufacturers to put the quality management system in place around those products. And they may actually go ahead and begin to do inspections and audits of companies who are manufacturers. But
when you look at the official stance of the FDA in regards to CBD, they have insisted you must file as a drug and you must do that whole submission. And yet the industry has flooded the market with products.
yeah,
So there's no point closing the barn door after the cows are out.
there's only been one CBD product that's actually been approved by FDA for interstate commerce. And it's a drug. Was for
Besides the Epidiolex.
epilepsy in children.
Right. I think there's another one, but I can't recall what it is offhand. But
Yeah.
I know that Epidiolex was the first one for sure.
Okay.
But when they did that, they kind of closed the door. Then the FDA had, what's the word I'm looking for? Precedents already set for everything going the drug route. And because all those products are so variable and could fit in so many different categories, I mean, they need to come up with some rules somehow.
Right. Well, let's hope they do before somebody gets seriously hurt or injured.
I agree.
Yep.
Okay, thank you, Steve.
Thank
And
you.
I saw another hand go up, but it's since been put down. Is there another question?
Anybody here have a question?
I'm curious about the FDA saying CBD is not acceptable in food, then how are we getting it into any edibles?
It's not. Yeah. There.
Okay, I don't see any other hands raised. Yeah, okay, so Charlotte, do you have any words for wrapping up, or shall we just say we'll meet again tomorrow at 1 p.m. Eastern? Of course, there's a separate link for tomorrow, so be sure you use tomorrow's link and not today's. And then I can send out the slides again. If anyone did not get it, just go ahead and email me. But Steve, I'll send you the slides one more time.
Yeah, well, I want to thank everybody for attending. Tomorrow, we will take a very deep dive into testing and specifications, which are very necessary, and then finish up the rest of the talk.
All right, sounds great. Well, thanks everyone. If you think of questions, of course, just jot them down and we can start tomorrow's presentation with any remaining questions from today. But we thank you all for your time and for joining us, and we will see you tomorrow at 1 o'clock Eastern.
All right, thank you.